Hi everyone, this is Neil Writer, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with the equivalent of a type 6 stool based on the Bristol stool scale, earwax, and I'll briefly explain what the Bristol stool chart is for, and the different categories, the different I think there's 7 characteristics of stool that are described within the scale, and they directly relate to identify if your bowels are healthy or not. So I know we're digressing a bit, but you can see with this earwax, it's really mushy. And I'm forever thinking about ways of classifying not only the amount of wax a patient's got, but the type of consistency. Now, the type of consistency of earwax doesn't necessarily relate to any ill health of the patient. As we know, with earwax, the type of wax that you have, the consistency is all down to genetics. It's based on a singular morphation of a gene, the ABCC11 gene, and depending upon one of the 2 types of mutations you have, determines whether you've got dry or wet earwax. And there's subcategories, and of course there are, if you've got an infection, for example, that's going to change the consistency somewhat. But in terms of the Bristol stool chart, this would be classified as a type 6. And I'll just go through the types. I've got a still image at the end of the video for you guys to see if you're interested. So type 1 is when you have hard lumps. So if we often get hard lumps of earwax, and in terms of how well your bowels are working, it suggests that they're very constipated in that respect. Type 2 makes reference to lumpy and sausage-like stool. So again, we do get types of earwax like that as well. So it's uncanny, the characteristic and the similarities between earwax and stool on occasions. And that means you're slightly constipated. Type 3 is when you've got a sausage shape with cracks in the surface. I think other people have described that as almost a corn on the cob appearance. And that suggests you've got normal stool. I'm sorry, guys, if any of you are having your tea or your breakfast or your dinner, but I mean, you're watching earwax videos anyway, so it's probably going to put you off your dinner in any case. Type 4 is seen as a normal type of stool, and that's when you've got a smooth sausage-like or snake formation of stool. Type 5, when you have soft blobs with clear-cut edges, so that suggests you're lacking a bit of fibre. And type 6, which is probably the most similar to this type of wax, is when you've got mushy consistency with ragged edges. And that means that suggests that you may have some inflammation in your bowels. And then last but not least, type 7 is a liquid consistency with no solid pieces. So that's inflammation and, of course, diarrhea. So out of those types of 6, this type 7 types of stool consistency, this is most definitely a type 6. And to help, because I want to bind it, I want to make this into a type 5 or even a type 4 wax, which is easier to remove. So I've just put the magic ingredient in, the medical grade olive oil spray. And what that attempts to do is bind the wax together, make it less mushy, and just bring it together, make it a bit more smoother, more like a type 4 or type 5. Still tricky. This patient's ear canal is somewhat narrow at the entrance, and there's a few hairs there. And because the wax is near the entrance, we're putting the oil in, the hairs can get coated with the oil, and then as you're putting the endoscope in, of course, because the wax is near the entrance, the endoscope's going to be in a similar position. It can somewhat smear it, so you might have seen that before. So I just came away and just given that a wipe. So the other thing I was suggesting previously was the grading system. So a grade 1 would be a partial occluding earwax, a grade 2 would be semi-occluding, a grade 3, 3/4 occluding, and grade 4, fully occluding. Now, I had some great comments back from a lot of people on that, and I think the suggestion was to make reference to the grading system, because I think the misconception a lot of the time is people assume the more earwax you have, the greater your symptoms, and it's not necessarily always the case. Sometimes you can get a patient with a little bit of earwax, and even myself, I think, oh, that's not really going to be the root cause of this patient's symptoms, and upon removal it makes a huge difference. Now that might be placebo, I don't know, but I mean, another example, you can have a patient with a very thin layer of skin just at the entrance of the ear canal. So if you think about the ear canal being 2.6 centimeters in length, you could have just a sheet of dead skin in thickness, I mean, 0.5 millimeter, for example, and that can create the same symptoms as someone with fully occluding earwax. Or indeed, we quite often get patients who come in with fully occluding earwax in both ears, but they only notice it in one ear, and the other ear they think is perfectly fine. So the grading system is more about the appearance. I know with keratosis obturans, it tries to... with keratosis obturans, your ear canal's generally blocked anyway. In terms of the occlusion factor, it'll be a grade 4. So with keratosis obturans, it more describes the symptoms, but that's something else to consider. But the consistency of wax is always something that I felt it could be described a lot better, because I use many different types of names during different videos of how to best describe the consistency, and no point reinventing the wheel, so to speak, because you got the Bristol stool chart there, and I think that's used globally, if I'm not correct, or at least in some of the countries. So with the right side, remove the occlusion. There's a bit of mushy wax on the canal wall. We used a bit of oil. I used a Jobson horn. I used a fine end. It wasn't worth risking getting that off because it wasn't going to cause the patient any symptoms, so I just left a little bit left. This there left side, I would say the consistency was here. I'm just having a look at the chart. I would say it was a type 5 because it's still soft, but it was obviously a bit firmer than the right ear, possibly even a type 4 even. So smooth sausage-like or soft blobs with clear-cut edges. And these are the official definitions, if I'm correct, so I'm not making them up. So Jobson horn really worked well here, and that's the stool chart. So I don't know whether I can make it efficient in any way or propose it, of course, in terms of earwax, but as you know, I've got loads of other things going on at the moment, so I will come back, we'll revisit this idea for sure. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.